I am a board certified internist with about 15 years of primary care practice before I came here to Emory. Um, Went to medical school with the interest in becoming a primary care physician. Um, and I actually delivered primary care services for a time in the community health center arena at a group of community health centers in Chicago. And in working with those patients, particularly during that time, during the 80s, when there was a lot of public discussion about healthcare reform, I realized that there was definitely a fair amount of reform needed in healthcare, and that physicians in general could use some additional knowledge about the economics of healthcare, how healthcare is delivered in this country, and the role the policymakers played in the delivery of healthcare. So I opted to go back to school for some additional training. I debated about additional training in public health versus um, public policy and business, and opted to get an MBA, and spent some more time in Chicago in healthcare delivery as a primary care physician and in medical administration, then moved down here to Atlanta. For inpatients, if they have chronic medical problems, diabetes, hypertension, infections, chronic pulmonary disorders, I manage those so that they can focus on their rehab, and so that their physiatrists, their rehab team can focus on delivery of their rehab services. And as I noted, I also will continue to provide those services on an outpatient basis for patients who don't have primary care physicians. Emory is a big referral center, and we get a number of patients from the region and actually from the country. We've even had patients from overseas. And those patients are, while they're inpatients at Emory, and even shortly following their discharge, may not have access to their primary care physicians for delivery of those services. And I seek to bridge the gap in providing primary care services until they can return to their homes and their primary care physicians. There are multiple. I'll try to highlight a few. To me, the biggest benefit is having access to, one, many different specialties, and two, individuals throughout the spectrum of medical care, all available and accessible in one space. So a patient can virtually walk out their front door, and all the medical services they will need for whatever medical illness are available right here in Emory. They can be admitted with a catastrophic medical condition. They can see the specialists during their acute medical stay or acute surgical issue in the medical hospital. They can have all the ancillary services there. They can have access to some of the best minds in research while they're there, because our research faculty work very closely with our clinical faculty. Not to mention the benefits of a teaching institution and the benefits of all the great minds associated with an academic medical center. The gentleman was involved in a motor vehicle accident while trying to do a favor for a family member. He was doing a good deed and suffered a major injury as a result of that. He had a fairly extended medical inpatient stay. He suffered a traumatic brain injury and multiple fractures, some respiratory failure associated with that, an extended time on the vent, and following that illness he was transferred to rehab because of the brain injury and the cognitive deficits relative to that rehab for his multiple fractures and just the deconditioning he suffered from his extended medical illness. He, at the time of transfer, was functioning at a very low level, could not transfer, could not perform any of the activities of daily living. He was a difficult transfer just from bed to the chair. He required a Hoyer lift, cognitively very low level functioning, little verbal interaction. He made some progress during his initial stay in rehab, which was just under 2 months. And at the point of discharge from rehab, was able to participate in some of his activities of daily living, We had educated his very devoted caregiver in how to transfer him from bed to chair using the Hoyer. He had begun to be more verbally interactive with his caregiver and his friends and family, and had progressed to the point where his caregiver, his fiance, was able to care for him at home. He went home, and largely because of his great motivation and his very devoted caregiver, he continued to make progress at home. So much so that after a short time at home, in reevaluating him on the outpatient basis, we felt he would benefit from additional time in rehab, and we readmitted him to rehab. I should also note he sticks in my mind because in addition to his multiple injuries with the accident, he developed a significant pressure ulcer during his medical hospital stay, and we cared for him and that during his rehab stay also. Because it was such a large ulcer, it took some time to heal. And in the several months following his rehab stay, he was followed not only by us on an outpatient rehab basis, but also by me in the wound clinic, and actually healed his pressure ulcer, and had healed it by the time he was readmitted to rehab for additional therapy. That second rehab stay was very successful. He had made some gains at home. We progressed to the point where he was able to transfer in and out of bed without the use of the Hoyer lift, making his care much easier at home. He began doing some of his activities of daily living and became much more socially engaged. He continued more therapy on an outpatient basis, and whereas before this was an individual immediately after his injury who had limited ability to carry on the conversation with someone, by the time he was completing his second phase of outpatient therapy, he not only was interacting socially with all of his families and friends, he owned his own business and had become re-involved in it and was actually making substantive contributions to the running of that business. So he went from a very low level of functioning to the point now where he's involved and participating in his business. He is actually ambulating, something we never thought he'd be able to do, not requiring any mechanical assistance and very little human assistance for his transfers and activities of daily living. He's definitely a rehab success story. I'm clearly biased, but I think we have the best, the most talented, the most innovative therapists in the region, and I'd actually stack them up against therapists anywhere in the country and the world. They are very motivated, very innovative when it comes to dealing with ticklish problems and difficult patients, and they don't shy away from a challenge. In addition to that, we also have brilliant, very insightful researchers here at Emory, a group of postdocs that are particularly skilled at translating their fairly substantial findings in their research into clinical practice, and a group who has a great relationship with the clinicians here and work very diligently toward translating those findings into benefits for our patients. I also feel we have a very dedicated and experienced clinical staff, really indefatigable group of nurses and doctors very committed to caring for patients here, and that's a combination of healthcare providers that you can't beat. I am what I think the popular term now is a foodie. I enjoy preparing elaborate desserts and great meals and all those new gadgets, etc., that you can find in the kitchen. So when I'm very stressed, that's what I do. I go in and I create something really beautiful in my kitchen that's enjoyable to eat.